This case features 4 e.max crowns that look pretty nice. You know, hard to tell till they get tried in the mouth if they're going to be great matches. But when they were tried in the mouth, they did not fit. And the dentist set them back and sent them back with a new impression. A second set of crowns were set out that looked very similar to this. And they also did not fit. And the technician came up to me and brought this and the impressions and said, why does it fit here and not in the mouth, both sets, and what's going on? I said, well, let's start with the impressions and go from there. And this is the first impression that was taken and poured up. Obviously, you can see there's still plaster around here. And so when we notice it's 7, 8, 9, and 10, 4 single unit crowns that have been taken with an anterior double arch tray. You can see that little plastic area, that little kind of hook or retainer that sits on the lingual side of the mesh on these anterior double arch trays. I'm not a huge fan of anterior double arch trays just because when the patient bites down, it's impossible to verify whether or not they're all the way together because you can't see the posterior teeth on the other side like you can if you're just doing an impression over in this quadrant. So you need to be real careful and make sure the bite's good. That really wasn't the issue here. The issue was they didn't fit. And first of all, if we go back to Gordon Christensen's research, Gordon has proven that double arch trays like this technique is great if you're doing 1 crown or 2 single adjacent crowns, and that's it. That's the outer limit, are those 2 single adjacent crowns. So whether it's a 3-unit bridge or 4 individual teeth like this is really beyond the indications of the double arch tray technique. And this should have been taken in a full arch, you know, it could be a stock metal tray, it could be a plastic tray. You know, the dentist did use a stiff material here. Since these anterior double arch trays really have no reinforcement on the lingual, they're not very strong when you go to bend it in this direction. So at least there's a stiff material in there. But also, when you look and you see that we've only got the light body material right around the teeth and nowhere else in the arch, you know, that's fine if it's a simultaneous technique. So if the green material is expressed around the preps while the assistant fills the tray and then it's put in, the 2 materials set together at the same time, it's usually not a big deal, but you usually see a little more blending at the edges of the 2 materials and you don't kind of see them stop quite like they do. So it gives me the feeling that it might be a 2-step impression because you can also kind of peel a little of the material away. It's been cut down a little bit over here on this side, but it just has that kind of 2-step look, like this was taken first with the blue mousse, so kind of maybe an H&H technique, although I hesitate to call it the H&H technique because it wasn't done with the materials that that technique specifies. But it does appear as though it was done as a 2-step where the blue mousse was done first, the patient opened up, and then some green material was placed around the teeth, patient bites back down. And if you're going to do that, there has to be green material the whole way on the rest of these teeth. All the occlusal surface needs to be covered because now we've taken an impression where we've got kind of 2 vertical layers. We've got the green that's here and the blue that was taken previously that was not relined. In fact, in dental school, when we were taking impressions in a 2-step method like this, we would take the putty first and then take a watermelon burr and literally just grind out every indication of any tooth that was in there. Basically, we were making a custom tray out of putty that happened to be inside of a metal stock tray, but you had to get rid of every little mark from any tooth that was in there. And then once you had done that, then you could syringe material around all the teeth and put the impression into place. But as it is now in a 2-step technique, as it appears to be, that's going to lead to inaccuracies because we're going to end up with a tighter fit. We're just trying to compress the teeth back into the same blue mousse area and squeeze some of the light body out. And that gets really dicey when it comes time for having crowns fit. And so here's the new impression that the dentist sent back that was fabricated. And you can see on this one, we can still see kind of that where those 2 layers are going to separate right along here. And that just doesn't happen when these 2 materials set at exactly the same time. When they set simultaneously, they're much more homogeneous in this area and you don't see this kind of peel away. So again, it was kind of apparently the same technique. Good retraction, by the way. I mean, that's great. I can see the margins. I can see past the margins in most of the area. Keep in mind that this has already been poured up in stone. So if you see this little tear right here, chances are it could have torn out while the model was being removed. So really a good job on retraction and enough reduction for e.max crowns. It's just this technique that's that's a little dicey. So first and foremost, it should be a full tray, not a double large tray, a full maxillary tray, something like a stock metal tray. And if you want to use, two viscosities like this, we would ask that you have them set simultaneously. Again, when we do it in the two-step and we're just simply relining it with the light body, a lot of our H&H doctors will say, oh, can I have 10 coats of dye spacer? Or 8 to 10, is usually what's asked for. And that's pretty thick. That's, all of a sudden we've got, 500 microns of space there, a virtual dye spacer if it's a CAD/CAM restoration, and that's quite a bit. There's that little plastic thing that we saw. In fact, that's another thing. You really can't tell if the patient's biting down on that. It looks like they cleared it, but it looks like they might have started there as they bit together and then cleared it. But a little difficult to tell, although it looks like they probably were in maximum intercuspation, but it's really much easier to tell if you do a separate bite registration on cases like these, and so that's what I've instructed the doctor to do, and he's willing to give it a try. So the next one's going to be a full upper impression, a full lower impression, and then a bite registration, and we're going to not do this technique. We're going to have them set simultaneously, and hopefully we'll be able to get a better result from that by not taking it in a double arch tray as was done here, and by using a syringe layer around the preparations, and then the assistant fills the tray. It gets sat down on top of that syringed layer around the prep, and it's going to set simultaneously, and 4 minutes later it's going to be one nice homogeneous impression. And considering how well the retraction was done here, I'm 99% sure that these 4 restorations will in fact fit, but there shouldn't have had to be 3 attempts.